Part of our commitment with the passage of the Affordable Care Act 7 years ago was a commitment to the building of clinics like this all around the United States. So no matter where you lived, you had accessibility to basic quality primary health care. And this is part of that vision, part of that network. Now the Affordable Care Act is being challenged in court. 20 Republican attorneys general have filed a lawsuit to eliminate the Affordable Care Act. They will be heard in a federal appellate court next week. I'm hoping that we can prevail and defeat them, because the Affordable Care Act has made a dramatic difference in America and in Illinois. 20 million Americans who did not have health insurance before the Affordable Care Act now have it. And in our state of 13 million, 1 million people previously uninsured now have health insurance because of the Affordable Care Act. The subsidy goes with it, so if you're low income, the cost of premiums will be reduced. But equally important, we changed the way people sell health insurance in America with the Affordable Care Act. So the notion that we would eliminate this and go back to the so-called good old days, making America great again, when the insurance companies could charge what they wish and discriminate as they wish, is unacceptable to most Americans and to me. I think people want to see us expand coverage and expand accessibility to affordable health insurance. And that's why I hope that this lawsuit from the Trump administration and the Republican Attorney General ends up being defeated in court next week when it's heard. We shouldn't be eliminating the Affordable Care Act. We should be improving the Affordable Care Act in terms of its cost, its accessibility, and coverage for families all across the United States. So this will be an important issue in this campaign, I guarantee it. And when we come to East St. Louis and see the particular challenge here, we can understand that there are still parts of this state and our country that need to have a conscientious effort made to provide basic health services to people who otherwise would go without.